It is National Women's Health Week, a time to encourage all women to make their health and well-being a priority. So, on today's checklist, we are focusing on some of the biggest issues women face and talking about how to advocate for yourself to get the care you need. So here to help us is NBC News medical contributor Dr. Tara Narula. Good morning to you.
Good morning.
So let's start with preventative care. It's one thing to talk about it once you're sick, but let's talk about it on the front end. Let's talk about some of the recommended screenings or discussions women should be having through different stages of their life.
Yeah, prevention is really the key to success, and that's with both cancer and cardiovascular disease and many other conditions. And so it starts really early. In your 20s is when a woman should be talking about getting screened or tested for cervical cancer. And also, it's a great time to know your numbers for heart disease. So things like blood pressure, cholesterol, your blood sugar, your body mass index. Fast forward into your 30s, a good time to figure out your family history. I just spoke to a woman yesterday who said, my family's wondering why I'm asking all these questions. We don't talk about our health.
Yes.
And I said, you're actually doing the right thing, right? It's really important to get a sense of what your family history is.
It's important.
And then in your 40s, this is where it begins. I had my mammogram yesterday.
Oh, wow.
It's never a pleasant experience, but so important. That starts around age 40, colon cancer screening around age 45. And then again, a good time to talk about perimenopause symptoms, which I know we'll touch on later. And then finally in your 50s, lung cancer screening for anyone who's smoked or smokes more than about 20 pack year history. And then osteoporosis screening. We often forget about the bones, but really important.
It's good.
You mentioned cardiovascular health. I know that heart disease is one of the biggest. I mean, it affects men, but obviously, I think it affects women probably disproportionate. Why?
You think right. So it kills one woman every 80 seconds. So by the time this segment is done, that's 6 women who've died, right?
Jeez.
Leading cause of death for women. About 45% of women don't even realize that this is their greatest health risk. And 45% of women over the age of 20 are living with some form of cardiovascular disease. So we know about some of the traditional risk factors, Craig, things like blood pressure, cholesterol, diabetes. But what's really important for women to know is there are sex-specific risk factors. So, for example, if you had early periods before the age of 11, that's a cardiovascular risk factor, as are things like lupus, rheumatoid arthritis, psoriasis, polycystic ovarian syndrome, migraine, pregnancy complications like eclampsia, gestational diabetes, miscarriage, early menopause. And then really important, if you were treated for breast cancer, for example, with chemotherapy or radiation to the breast, that in and of itself is a risk factor. And then menopause. Once you pass through menopause, your cardiovascular risk goes up. So it is a continuum and really important to think about those stages for women.
Let's talk about menopause, because I feel like finally more people are talking about it, and it's become more of a discussion. Why is it important? I mean, this is a major life-changing event.
Right.
That needs to be talked about.
It's so important. And I can tell you for many years, I was told we don't talk about menopause on morning television, right? And this is something that has been really understudied. Women don't know how to recognize symptoms. We don't get trained or didn't get trained in medical school for this. So it's really unfortunate. And finally, we have women speaking out. We have Halle Berry yelling.
I just saw on Instagram.
I'm in menopause. Oprah Winfrey, Drew Barrymore. And so people are really shining a light on this important stage in a woman's life when you can experience many symptoms, over 30 symptoms reported. Things like irregular periods, mood swings or changes, hot flashes, night sweats, vaginal dryness. I mean, a lot of different things can happen. So it's important for women to identify this, to speak up. There's no stigma or shame around this. And we have treatments now, even non-hormonal therapy treatments. There is a drug that came out about a year or two ago named Veoza for hot flashes. So a lot of options for women. Really important.
There are menopause specialists.
There are menopause specialists, yes.
So if you don't know, you don't know. A deep statement, I know. But I just feel like if you're sitting in a place somewhere where you just don't know about the resources or you don't even know what to ask.
Right.
So if nobody's asking me, how would I even know?
That's why you have to bring it up. You have to say, could these symptoms be perimenopause? And if you don't get the right answer, find another doctor.
Just seek different options.
Correct.
That's good. Solid.
I've learned a lot.
I know.
I've learned a lot. Thank you.
Good.
Thank you, Dr. Tara.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.